Congratulations on this test kit. We need to get these tests out across the country clearly so that we have a better understanding of where we stand with the virus. I want to hear about how far along you are in that process. You had big plans to ship out several 100,000 tests this week. Has that happened? And how many people are currently getting tested across the country?
Right. So thank you very much for having me on your show. We expect to ship tests sometime early next week. Perhaps we'll catch a few tomorrow, but likely early next week. A couple of 100,000. And then within a week or two from that, more, and leading to millions within, hopefully within a period of time, say a month or two.
So, Stanley, give us an idea here. I mean, when we talk about these antibodies, for folks who aren't scientists and doctors, help us understand this. Does this mean that a person who has these antibodies is basically immune from getting COVID in the future? Is that the idea?
No, I don't think the science is that developed that anyone can say at this stage whether you're immune from having the virus again in the future. These tests can, together with other tests like the PCR test or an antigen test, determine whether you are immune at this time. And but no one can tell you whether whether you will be completely free of the coronavirus in the future. We just don't know enough at this stage. But this test can help determine your status several days out. Probably more like 10 plus days after you've been infected. And by the way, none of the tests are perfect yet. The PCR test, the molecular test, which is an early stage test up to about 7 days, antibodies somewhere around 5 to 10 days, antigen up to 5 to 10 days, and antibodies over 10 days. These could all be used in unison by a practitioner to determine, given your symptoms, whether you are likely to be clear or not.
So, Stanley, are you preparing for this to be a seasonal thing? For instance, do you expect to offer this test along with influenza and other illnesses next year, or did you build this as a one-off?
Well, we are not sure about that either. Unfortunately, we have to be really careful. Sometimes it's interpreted that this is a very simple environment, like a pregnancy test, yes or no. It is much more complex. These three kinds of tests need to be used in unison. Look, I'm not a physician, I'm not a public health person, but this is the way I understand it, and that the three kinds of tests, in one way or another, working together, can help diagnose whether somebody is clear or not. And we just don't know enough to be 100% sure whether this virus will come back or not. It's not a typical flu-type test, nor is this virus in the flu, exactly in the flu category. We don't know whether it's going to come back or not, and hopefully it will not. But these tests will be helpful in getting people back to work, healthcare workers determining whether they've had the virus or not. Science, unfortunately, at this stage is not perfect.